Today we're going to be discussing pressure injuries, which is chapter 41 in your textbook. A pressure injury is localized damage to the skin and underlying soft tissues. The injury could be the result of pressure in combination with shear. Shear occurs when layers of the skin rub against each other, or when the skin remains in place and underlying tissues move and stretch, leading to tearing underlying capillaries and blood vessels, causing tissue damage. For instance, a patient slides down in the bed or a chair. This damages the blood vessels and tissues, which reduces blood flow to the area. Pressure injuries usually occur over a bony prominence or are related to a medical device. Bony prominences are areas where the bone sticks out or projects from a flat surface of the body. The back of the head, shoulder blades, elbows, hips, spine, sacrum, knees, ankles, heels, and toes are bony prominences. Finally, a pressure injury may involve intact skin or an open ulcer. Intact skin refers to normal skin and skin layers without damage or breaks. An ulcer is a shallow or deep crater-like sore of the skin or mucous membrane. The term pressure injury, pressure ulcer, and bed sores are synonymous. This image here shows the skin being squeezed between two hard surfaces, the body and the mattress. This decreases blood flow to the skin and underlying tissues. As a result, oxygen and nutrients cannot get to the cells, and the skin and tissues die. This picture shows the skin being squeezed between two hard surfaces, the body and external device like tubing. This decreases blood flow to the skin and underlying tissues. As a result, oxygen and nutrients cannot get to the cells. The skin and tissues die. There are a lot of risk factors for pressure injuries. Age-related skin changes, such as thinning of the skin and loss of the fatty layer under the skin, are one risk factor. Skin breakdown and non-intact skin is another risk factor for developing pressure injuries. Skin breakdown involves changes or damage to intact skin. Dry skin is a risk factor for pressure injuries. Chronic diseases, such as diabetes, can result in reduced sensation and are also a risk factor for pressure injuries. Decreased mobility is a risk factor for pressure injuries. Sitting or laying in one position for 2 hours can result in a pressure injury. Bed fast, meaning confined to bed, and chair fast, meaning confined to a chair, are at increased risk. Also, lying on wrinkled sheets increases an individual's risk of developing a pressure injury. Incontinence is a risk factor for pressure injuries. Moisture irritates the skin and also increases the risk of friction and shearing during repositioning. Poor nutrition and hydration are risk factors for pressure injuries. A balanced diet nourishes the skin. Fluid balance is needed for healthy skin. Edema, which is the swelling of body tissues with water, is a risk factor for pressure injuries. Agitated patients with involuntary muscle movements can have rubbing or friction against the linen and other surfaces, which increases their risk of developing pressure injuries. Medical devices are risk factors for pressure injuries. A pressure injury can develop where a medical device sits on the skin. This includes braces that do not fit correctly. Finally, existing or healed pressure injuries are also a risk factor. This slide here shows the areas at greatest risk for pressure damage: the back of the head, shoulder, elbows, buttocks, and heels, the ear, the hip, the thigh, and the leg, the rib cage, the knees, and the toes, the head, the shoulder, the sacrum, the buttocks, and the heels. Pressure injury staging is done by an RN. With stage 1, you have non-blanchable erythema, which means that the reddened skin does not become white or pale when pressure is applied and removed. With a stage 1 pressure injury, intact skin has a reddened area that is non-blanchable. Stage 2 pressure injuries occur when the wound is pink or red and moist. It may involve a broken or intact blister. Fat and deeper tissues are not visible. With stage 3, the skin is gone. Fat can be seen in the ulcer. Slough and or eschar might be present. Slough is dead tissue that is shed from the skin. It is usually light-colored, soft, and moist. It may be stringy at times. Eschar is a thick, leathery dead tissue that may be loose or adhered to the skin. It is often black or brown. With stage 4, the skin is gone. Muscle, tendon, ligament, cartilage, and or bone are exposed. Slough and or eschar may be seen. An unstageable pressure injury is one that has obscured full-thickness skin and tissue loss. The extent of tissue damage cannot be seen because of slough or eschar. A deep tissue injury is persistent, non-blanchable, deep red, maroon, or purple discoloration. The wound is dark or is a blood-filled blister. The skin is intact but can be firm, mushy, or boggy. This picture here shows the different stages of pressure injuries. This picture here shows some examples of stage 1 pressure injuries. Stage 1 can be reversed if treated early. Some CNA interventions are repositioning the patient every 2 hours, keeping the skin clean and dry, avoiding massaging the area, using positioning devices to prevent pressure on bony prominences, keeping the head of bed as low as possible to reduce the risk of shearing, and keeping the sheets dry and wrinkle-free. These are examples of stage 2 pressure injuries. With stage 2 pressure injuries, care is similar to stage 1, except the wound should be covered. Pressure ulcers that develop beyond stage 2 are due to lack of aggressive intervention. These are examples of stage 3 pressure injuries. The goals of treatment with stage 3 pressure injuries are to debride and dress the wound cavity and protect the wound from infection. This is a stage 4 pressure injury. Again, the wound would be debrided and we would keep the wound protected from infection. These are examples of unstageable pressure injuries. The goal is to safely debride the wound to the point where it can be staged and treated. And then this is an example of a deep tissue injury. This is a picture of a Kennedy terminal ulcer. Kennedy terminal ulcers occur over a bony prominence 2 to 3 days before death. The sacrum is the most common site. The cause is thought to be skin failure. The skin, along with other body organs, shuts down 10 to 14 days before death. The onset of the Kennedy terminal ulcer is often sudden. They are shaped like a pear, butterfly, or horseshoe. And the Kennedy terminal ulcer can be red, yellow, purple, or black. Medical device-related pressure injuries develop at sites where devices are used for diagnostic and treatment purposes. So on the left side, you can see a clamp that was pushed against the patient's leg. The middle picture shows an ear pressure injury, probably from oxygen tubing. And the picture on the right shows Foley catheter tubing that has left an indentation on the patient's leg. Mucosal membrane pressure injuries occur on mucous membranes where medical devices are used. So in these pictures, you can see injuries on the nose and the lips. Due to the anatomy of these tissues, these ulcers cannot be staged. Unavoidable pressure injuries occur despite efforts to prevent them through proper nursing care. Avoidable pressure injuries are pressure injuries that develop from improper nursing care. Some ways to prevent pressure injuries include repositioning every 1 to 2 hours and using repositioning devices, not leaving patients on the bedpan longer than needed, not allowing patients to sit on donut-shaped cushions, floating the heels, not dragging the person when transferring, inspecting skin when providing care, not massaging over pressure points, keeping the bed sheets clean and wrinkle-free, and toileting patients every 2 hours. When patients are sitting in chairs, it's important to remind them to shift their weight every 15 minutes. Here are some examples of positioning devices. A bed cradle is a metal frame placed on the bed and over the person. Top linens are brought over the cradle to prevent pressure on the legs, feet, and toes. Bed cradle is seen in the bottom left and right pictures. Elbow and heel protectors, heel elevators, gel cushions, and specialized beds are also used to prevent pressure injuries. In the upper left corner is an Aleven dressing, and that is a special dressing you can put on the sacrum. There are also ones for the heels and elbows, and it's meant to prevent pressure. The bottom left is a heel elevator. It keeps the heel off the hard surface of the bed. The top right is an EHOB cushion, and that's used to distribute the weight of the patient's body, so they're not sitting in one spot all the time. And the bottom right is a wedge cushion that can be used to reposition patients on their side. Some complications of pressure injuries include infection and pain. According to CMS, all stage 2, 3, and 4 pressure injuries are colonized, which means that they have the presence of bacteria on the wound. Osteomyelitis is inflammation of the bone and bone marrow. Pain is severe. Treatment involves antibiotics. The senses have a role in helping identify pressure injuries. For sight, look for changes in the resident's skin. Report to the RN. For hearing, listen to the resident and family. Are they complaining of pain or discomfort? For touch, touch and feel for any changes in the resident's body. Report changes to the RN. Smell, report any unusual odor. Here are some important things to report to the RN. Change in skin coloration over a bony prominence, dry, cracked, flaking skin, torn skin, blisters, bruises, or cuts, a resident that itches or scratches his or her skin frequently, broken skin anywhere on the body, any change in an existing pressure injury, so drainage, odor, peeling, skin, color, size. The Braden scale is a universal scale that is used to predict the likelihood of a patient developing a pressure injury. This slide here shows a picture of the Braden scale. And here's an example. So a 22-year-old female admitted status post-MVC, patient found to have T10 cord ischemia. Sensation is absent in the bilateral lower extremities. Bilateral lower extremity strength is 0 out of 5. The patient has a Foley catheter for urinary intention. She is incontinent of bowel. She eats 75 to 100% of her meals. So if we look back at the Braden scale, for sensory perception, she would get a 1. She's completely limited. For moisture, she would get a 2 or 3. She has a Foley, so that's collecting her urine, but she's incontinent of bowel. For activity, she would get a 1 for bedfast. Mobility, she's very limited because above T10, she doesn't have movement. And nutrition would be adequate. She eats about 75% of her meal. So she would have be an 8. on a Braden scale. Anything less than 14 is high risk for developing pressure injuries. So this patient described is at a high risk for developing pressure injuries, and appropriate interventions would need to be applied.